See, I stumble into this. I didn't purposely think about this. And I think a lot of times that's what you do. You don't really think, oh, 20 years from now, this is where I'm going to be. You just kind of go with what's there. And I think we started in it because we had a passion for caring for people. And the more you do it, the better you get at it. And it just grew because we're good at what we do. I had a small business doing bookkeeping and payroll for small business. And I had gals working in their homes doing that. And I would get the clients and they would do the accounting stuff. And I had a friend who had started a home care for a national company that had retirement communities. And she came to me and said, oh, they're going to go into bankruptcy, and this little home care, which had 4 employees at the time, is going to go into bankruptcy too. So I said, well, let me do a pro forma and let's see if this would be a good business you'd want to invest in and whatever. So the farther I got into it, I thought, well, this is a good business. Maybe I'll invest in this and it'll be another one of my clients. Well, that went out the window real quick because we invested in it. We, bought the business from them, and then I didn't have time for the other business and sold it to one of the gals that worked for me.
So when were you diagnosed?
In June of '91. Surgery in August. Started the business. Opened the doors officially in November. So through that whole process, talking to attorneys while I'm laying in bed, and you just do. I would say it probably kept me going, keep me busy, and I'm be out of trouble. I guess maybe because we all have things we're going through, and maybe that's made me more sympathetic to people that are going through it in our office. But I'm much too positive to dwell on the negative, and I think it's made it better. I just don't think about that stuff. I just plow through and dig into business and move forward. And it gave me the incentive to want to really be in the healthcare business and be understanding of people that are going through stuff. We cared for my mother when she was sick, and it gave me a little different perspective, being a daughter, having care. Then I really realized what our clients are going through. Because most of the time they don't know what's going on. They don't know what to ask, what do I need next? And we can be the resource for that. I spoke at something at IU for the master's program, and somebody said, well, what really was important for you? And I said, to take psychology classes and to learn how to deal with people, because that's what you do for business. For all your staff and all your clients, that's all you do is be able to figure out what they need and what they want and how to get it. I do a lot of counseling to our staff, just to try to help them figure out what they need to do, whether it be personally or financially. I got a lot of questions about taxes and that kind of stuff, and I just thought I needed to be able to speak to them and be able to understand where they're coming from. I have an open door policy, and everybody trumps through here. And that's okay. That's what I'm here for. Probably because I obviously was the oldest of 6 and, was nurturing from that standpoint. I probably had a little bit of something, but I think that just expanded it and made me really want to help people and see that side of myself that accounting didn't give me by itself.